Hello everyone, I'm Dr. Madhuri Prabu. I'm a consultant neonatal pediatrician at Chennai Motherhood. Today I've come to talk regarding a very important but at the same time a very common topic, how to treat colic in newborn children. This is a very common one that a lot of parents go through, and they get really very worked up with children crying in the middle of the night or even throughout the day with this problem with colic. So children with colic, there are of three different types. So colic is a very normal phenomenon. It is just air in the stomach. So a lot of children have air in the stomach and they are easily able to get rid of it. So that is the commonest we see. There are some children who actually struggle with colic on a medium level. So when you give them medications like, there are a lot of colic drops available in the market or frequent burping, all these things can help and the children are able to get through this time. There are some difficult children who suffer a lot with colic. So these are the ones that parents get really worked up, especially they keep crying in the night, children cry in the night and they don't get to sleep at all, and nor do the parents get to sleep. So this becomes a very difficult issue for the entire family. Sometimes there are children who actually are intolerant to the cow's milk protein in the diet which the mother takes in. So at those situations we ask them to ask the parents or the mother to avoid taking milk in the diet. The mother has a lot of substances which cause a lot of gas in the mother's stomach. The other thing is, if the mother or the family is not burping the baby adequately enough, this again can cause a big issue in the baby. Babies tend to cry a lot. So frequent burping, sometimes even breastfeeding babies struggle a lot. So most often it is the children who are on bottle feeds or formula feeds who struggle a lot with colic. But sometimes you do see that even children who are breastfeeding also struggle. So there are some sort of other medications like prebiotics, probiotics, which also can help. Also, the main thing is burping often and frequently often. But the good thing about this whole thing is all this colic usually tends to settle down by about 3.5 to 4 months of age, of baby's age, and you would really wonder, is this a baby who was crying throughout the night? So they become really very cheerful and normal babies later on. But up until then, some babies, very few, maybe I would say about a few percentage, about 5% of the babies tend to have a severe colic, and they are the ones who struggle a lot. The most of them usually should be okay with the medications that are available. So if you are really struggling with colic problems, you should see your pediatrician and they should be able to help you out. Thank you.